In CMS, the Centers for Medicare and Medicaid Services, we actually have a innovation center. I don't know if you all have heard of that. We have a whole center who their whole focus is how do we do exactly that? How do we improve quality of care and lower costs in healthcare? One of the things that we're doing, that's what the accountable care organizations are focused on, is how do we get people to a place to incentivize people to work together to provide? How can we get people to coordinate more on care? So we don't give people the same 4 or 5 tests over and over again when one test would have done. How can we make sure that if I'm talking to this social worker and I'm also talking to the physical therapist, as well I'm talking to the dietitian and I'm talking to the primary care physician before I do anything related to their heart, that I got a complete picture about what's going on with this person's health rather than me just prescribing, another MRI, which costs a lot of money. That is what the whole initiative Partnership for Patients is about. I don't know if you're familiar with this, but we have a Partnership for Patients that's focused on employers, doctors, nurses, hospitals, everybody in the healthcare spectrum to figure out, basically they sign on to a pledge. How can we, over the next 3 to 5 years, eliminate, or really reduce strongly, but hopefully to eliminate, hospital-acquired conditions? You go into the hospital for one thing and you're healthy, but because you get a bed sore or you get an infection of some sort, you're now in the hospital longer, you get sicker, and guess what? 100,000 people die every year unnecessarily because of hospital-acquired conditions, that they die of something else that they didn't even go into the hospital for. So this Partnership of Patients is saying, how can we use the best quality practices? How can we find out who's all around the country is doing the best of that? Who had 0 hospital deaths last year in their 600-bed facility because they have these protocols in place? And how can we share that with other hospitals who are having major problems, other physician practices who are having other problems? How can we share that information and then test those models out to see if there's something that we can duplicate or replicate across the country, again, to lower costs?